Hello, I'm Dr. Talbot from the Animal Hospital of Statesville, and today I'd like to help you better understand dog vaccination.
So, Dr. Talbot, what vaccinations does my dog need, and why are they important?
That's a great question. So there are two different categories that I like to use when talking about vaccinations. The first category is what we call the core vaccines, which are the ones that every dog should have regardless of any type of lifestyle or any other external factors. The core vaccines for dogs are DHPP, Bordetella, and rabies. DHPP stands for distemper, hepatitis, parainfluenza, and parvovirus. And this vaccine protects against these several diseases that are likely fatal if your dog is infected. Bordetella is the vaccine that protects against kennel cough, which is a very highly contagious respiratory disease that can develop into pneumonia if it becomes severe, and especially affects young puppies. Lastly, the rabies vaccine protects against just that, rabies, which is a rapidly progressive and fatal neurologic disease that can be transferred to humans. This is why the rabies vaccine is required by law, not only to protect your dogs, but also to protect people. The second category of vaccines is the non-core vaccines, which are considered optional, and we recommend some over others depending on each dog's specific lifestyle. These vaccines include lepto, Lyme, and flu. The lepto vaccine protects against leptospirosis, which is a bacteria that can be spread through urine of wild animals and has been known to contaminate lakes, ponds, and even standing water or puddles. However, the lepto vaccine is actually being required by us now as a core vaccine to be vaccinated against. Lyme is a bacterial disease that can be spread through tick bites, and it can impact the joints, blood clotting properties, and in some cases even harm the kidneys. The flu vaccine protects against influenza, which is a respiratory disease, I say that 10 times fast, that can cause the development of pneumonia also when severe. While not required, all of the non-core vaccines should be considered at least, depending on your dog's particular lifestyle.
Are vaccines for dogs really safe?
Yes, vaccines are generally safe for your dog, and the benefits really outweigh those potential risks of being infected with certain fatal diseases. Vaccinating your dog is just a very crucial step in protecting their health and their well-being.
Are there any risks or side effects to vaccinations?
Yes, that's a great question. We get that all the time. With everything, there's always some calculated risk with any vaccination. Some dogs can experience mild side effects, including just some localized swelling, lethargy, fever, which are usually short-lived and resolve very quickly. However, some dogs can have severe allergic reactions or even anaphylaxis, which are generally rare, but more likely with certain vaccines over others. Even though vaccine reactions can be scary, they are able to be managed and treated by your primary veterinarian. So there is no way to know which dog, will have a vaccine reaction, which will not, but some are just more susceptible than others. It is important, to monitor your dog closely after vaccination or to be able to spot these reactions and address them very early.
At what age should my dog need or receive its first vaccinations?
Yeah, so puppies can receive their first vaccinations between the ages of 6 and 8 weeks old. These vaccines usually include that DHPP and Bordetella vaccine. Other vaccines like the canine flu, lepto, Lyme, rabies, long list, can all be started between the ages of 10 and 12 weeks.
How often will my dog need booster shots?
Yes, another great question. After your puppy's first vaccines at that 6 to 8 weeks, it's recommended to booster the DHPP every 2 weeks until they're about 16 weeks of age. If your puppy's over 16 weeks old, then 2 vaccines 3 to 4 weeks apart is usually recommended. However, rabies is the only exception, and your dog is considered protected 24 hours after that first initial vaccination. All other lifestyle vaccines, including the lepto, Lyme, and flu, are a 2-shot series, which should be given 3 to 4 weeks apart. After the initial series of any vaccination, it's recommended to booster each of those annually after that.
Should my dog get vaccinated for Lyme disease?
Since Lyme is considered a non-core vaccination, it depends on your dog's lifestyle as to whether or not they should be vaccinated against Lyme disease. If your dog is the type to go hiking, spends a lot of time outdoors, and tends to live in very forest-surrounded areas, then the Lyme vaccine may be recommended. Lyme disease is carried by ticks, and the first step that you can take to protect your dog is by making sure that you are utilizing diligent monthly flea and tick prevention like Bravecto, polio, NexGard, Simparica Trio. However, just missing, 1 monthly dose can expose your dog to this infection. And if you are one to forget, maybe every now and then, it may be a good idea to just vaccinate your dog against Lyme just in case.
So what are the symptoms of an adverse reaction to a vaccine?
Yes, so if your dog is having an adverse reaction to a vaccine, you may notice things like some vomiting, maybe some diarrhea, facial swelling, or hives. If you see any of these symptoms after your dog has received a vaccine recently, then you should seek veterinary care immediately. These adverse reactions generally tend to occur within, the first 6 to 8 hours after the vaccine, but it can even happen up to 3 days after the initial series. If you're questioning, if your dog is having a vaccine reaction, then please just reach out to your primary veterinarian for all this guidance and other tips.
Will my dog be sick after their vaccination?
It's rare, but it's very possible that your dog can get sick after a vaccine, especially if they have a lot of vaccines given all at once. It's best to work, with your primary veterinarian just to decide on a good vaccination schedule per se for your individual dog in order to make sure that you're, doing the best and trying to reduce the risk of illness after vaccines.
Can my dog be vaccinated if they're sick or on a medication?
Great question. If your dog's currently sick, then generally it's not advised to vaccinate at that time. However, in some cases, rabies vaccine can be given. It's the only one required by law. So all other vaccines, including rabies, stimulate the immune system, and if it's compromised or weakened by some disease, then the body may not mount the appropriate response to that pathogen in the future. And therefore, that vaccine was ineffective and may even have to be re-administered. Additionally, certain medications, including like immunosuppressant, like steroids, some cancer treatments, those can interfere with your dog's ability to mount that reaction for the vaccines. But you got to just make sure you inform your veterinarian of your dog's health status and any medications that they may be receiving prior to vaccines.
What is kennel cough, and should my dog be vaccinated against it?
Yeah, so as discussed a little briefly before, kennel cough, it's highly contagious respiratory disease, and it can be characterized by persistent hacking cough, and that disease is caused by like a combination of a lot of different viruses, bacteria, with the most common pathogen being Bordetella bronchoseptica, which is why they call it the Bordetella vaccine. Kennel cough's usually not very severe and can spontaneously resolve without treatment in most cases. But if your dog is young or is a puppy, it can lead to other complications like pneumonia and even death in those dogs. And all dogs should be vaccinated against kennel cough just to help reduce the spread to others, especially if they tend to go to the groomers, dog parks, doggy daycares, and are around other dogs in general.
So is the canine influenza vaccine necessary for my dog?
Yeah, so canine influenza, another respiratory pathogen, much like kennel cough, and dogs generally, recover within a couple weeks. But again, can lead to pneumonia in especially immunocompromised patients, young and old. And the same environmental risk factors as for kennel cough, including groomers, dog parks, doggy daycares, can increase your dog's risk. And in these cases, the influenza vaccine should be at least considered.
So can vaccinations be harmful if my dog is pregnant?
Yes, so vaccines, especially live vaccines, can pose a risk and cause harm to unborn puppies and cause other complications during pregnancy. Abortion and even like absorption of those puppies within the uterus can occur, and if you know or think your dog is pregnant, please just inform your veterinarian prior to pursuing any of these vaccinations.
So how much do dog vaccines cost?
Yeah, that's a great question. We get that all the time. Vaccine prices do vary and can range from $15 to even $100 depending on location, clinic type, supply, demand of any of the vaccines. They're usually at our hospital range from $20 to $45. And to get a most accurate price, you really should contact your veterinary practice just to reach out to them directly for that information.
So what should I do if I miss my dog's vaccination appointment?
Yes, so I know we got busy lives, things like this happen, and I feel like if you do end up missing, your dog's vaccine appointment, then just reach out to us as soon as possible just to get that rescheduled. Depending on certain vaccines that your dog misses, there's specified time frame that it can be overdue before you have to completely restart that series. The time frame varies, but a good general rule is no more than 6 weeks past your dog's vaccine due date. And if you aren't sure, what your dog's next vaccines are due or anything like that, just please reach out to your primary veterinarian to keep your furry friends on track for a healthy life.
And your rabies vaccine should never be left.
Yes.
It should never be overdue. It's always really important to have that done before the date it's due or on that date.
Very important. Rabies vaccine required by law, so just get it done. I promise it'll be worth it.
Yeah, if anything happens, you don't want to have to deal with
the state, the government.
Yes, the government, because they will come down on you for that one.
Absolutely.
So if you have any questions about dog vaccinations, please give us a call and talk to one of the veterinarians, and we can help you figure out exactly what your dog needs and when they need it, and let you know what the schedule needs to be.
Yep.
Thank you.
Reach out. Bye.
Bye.